and g'day YouTube, and welcome to my next Living with Bladder Exstrophy content. This content I'm going to talk about is living with bladder exstrophy and urinary tract infection and looking after yourselves with infections, preventing infections, and just trying to slow up infections a lot. Now, bladder exstrophy, we definitely have a lot of infections, and that's normal. It's just really annoying that we have them. Having a foreign object like a catheter going into our body, no wonder we get infections. And, we just got to try and look after ourselves. Yes, I know it's hard, and some people find it hard. Some people find it really easy to live with catheters and, and just continue on with their lives, which is great, and that's good for them. Thank the Lord for that, for them, but people that struggle like I do, and the majority of people, infections suck. And when they do hit, they hit us like a bag of potatoes or something. And when we fall down and we just trying to focus on all of that is so hard. And, trying to get back on our feet when you have an infection sucks. It's hard. It plays on your mental health when you have an infection, and we've got to try and catch them early and go to your GP and start treatment, and try and start treatment ASAP. Don't let it linger too long, or they start going into kidneys and having kidney infections, and they suck. They are the worst thing to knock you down on. And trying to do looking after that is hard, I know, and I'm in the same boat. We need to try and be positive in our lives when we have infections. Infections are pain, but when we can just slowly work out and get rid of them, we're fine, and just trying to look after ourselves a little bit better, having a bit better hygiene. Our hygiene is top notch, but we need to just stretch it out a little bit more. It's hard, I know. Catheters, trying to keep them clean and trying to keep up with supplies and all that. I know it's hard and it's a struggle, but it shouldn't be a struggle for us. There should be, we should be able to get the support and all that. And I know that it is hard for some people to get that supply, and I understand that, but we need to fight hard to try and get back onto our feet, dust ourselves off, and just focus on getting ourselves better if we have infections, because they knock you out, they knock you for a 6, and just trying to get back into life after it is difficult as well. But, keep up our fluids. Definitely keep up water as much as you can, because it flushes out infections. And, water is our best friend. We need to drink a lot of water to keep our system a top notch, just just keep on that. It's hard, I know, but we need to look after ourselves. And when we are adults, we need to just take the bull by the horn and say, look, we need to do this, and we need to do it. We need to not slack off. Slacking off is so easy, I know. And there are days where we just want to do our own things, go off, enjoy the world. And enjoying the world is great. It is the best thing we can ever do. Enjoy the world. But there are times when we overdo it, and we need to take a step back from that and say, I need to get back into looking after myself and making sure that we can keep an eye on things. Now, parents of children with bladder exstrophy and infections, we need to try and help our young ones as well. And you guys are the front line in that, parents. And you need to try and focus. I know it's hard. But you guys are doing a really, really good job looking after your children. We need to make sure that our kids understand that this is going to be a long life thing. And they need to know that they need to keep water up to themselves, and the slightest hint of an infection needs to be seen by the GP to know that you're doing the right thing looking after themselves. And we need to try and make them understand when they're teenagers as well that they need to look after themselves. When they reach teenage years, everything slips away again. And I know they want to have fun. I know they want to do teenage things, but they need to try and look after themselves and start taking things in their own hands and make sure that infections are at a minimum. Because when they don't focus looking after themselves, infections will happen, and it's gonna suck, and they're gonna be miserable. And we don't want them to be miserable. We want them to be happy with smiles on their faces. And infections we need to keep on top of. Even the adults, we struggle, we drift sometimes, but we need that slight reminder that we need to get back on the right way again and minimize our infection rates. You know, we need to keep our hygiene up, we need to keep our fluids up, you know. And to the children, please listen to your mummy and daddy. Please, you know, we need to make sure that you're all healthy and okay and fine. You know, listen, and if your mummy and daddy tell you a thing, please do it. To the teenagers, you are getting to an age where you should be able to self-manage, and you know, it's hard being a teenager, and I understand that. I was in that boat, and you know, you want to do things slip away. You want to focus on school and want to focus on a career eventually, you know, but you've got to remember, keep this in your heads that you've got to look after your bladder health. You got to keep up with hygiene, and you've got to keep, you know, the infections down. And if your parents say something about bladder exstrophy to you and you don't do anything, please listen to your parents. Please, guys, just take a few minutes out of your day and just do what you need to do. You need to look after yourselves. Please, adults, you know, we have careers and we have jobs that we have to attend to and all that. And there are days where we just have to work, and we totally forget about ourselves. But we need to try and find that extra little bit of time to just step aside and think, have I looked after myself? Have I washed my hands properly? Is my supplies up to nick? Do I need to flush, or do I need to do anything to keep us from not getting sick? Because sometimes with infections, it affects people differently, and some people with bladder exstrophy, it affects them so bad that they've got to spend days away from work. And some people don't have the effects of it that badly, which is great, but the majority, we struggle, and it's not easy. It plays on our mental health, makes things even worse, which we don't want things to be worse, But if we just focus, reach out for help, there is plenty of help out there on the internet, out there, all through Facebook. There is groups there that are willing to help, and speak to your doctors. They're willing to help, and speak to your urologist if you're concerned about having so many infections like I was having. They can work out a plan. Start doing syringe flushing, or having a long period of antibiotics or something. Just make sure that you always follow up with your GP or your urologist, just to make sure that they know what you've been doing. They know that you have been looking after yourself. We don't want things to get worse. We want things to be better, and we want to make sure that you all live a happy life. Okay, guys? Please pass this on to your fellow BE people, that if any of you know who needs a bit of a talk about this, I am willing to chat about bladder exstrophy and infections if there's anything that you need to know about. Like I said, please wash your hands. Make sure you clean as much as possible. Make sure you keep using new catheters every time you urinate. And, that will try and minimize the lack of infections. Please make sure that everyone, from children, teenagers, adults, anyone in between, please make sure you look after yourselves. And you guys will have I hope you guys have a wonderful day. Have blessings all the way from Australia. God bless everyone, and have a wonderful day wherever you are in the world. See you later, guys. Bye-bye.